Hello, everyone. Good afternoon and good evening to all of you, wherever you are. I, Dr. Jay Savai, on behalf of my entire team of Unique Pharmaceuticals Limited, would first of all like to take this opportunity to welcome each one of you for this very interesting web-based virtual scientific program. To tell you more about our pharmaceutical company, Unique Pharmaceutical Company is a holistic pharmaceutical company that is built on a solid foundation of trust, integrity, and always putting patients first. Our purpose is to contribute to healthcare globally, support healthcare providers, and enrich patients' life. Today, we are more than a 4-decade-old pharmaceutical company with presence in more than 40 plus global markets. And we are also one of the largest manufacturers of both medicated as well as herbal lozenges. And we have got presence in multiple therapeutic categories with some of the well-known brands like Zecuf, Easy IV Syrup, Q4, and well-known, which are available in the international market. And we are also one of the leaders into the therapeutic segment of cough and cold. I think in the past, through various scientific platforms, we have always connected with multiple medical specialties, and we believe in disseminating knowledge through various scientific engagements with experts in the field of medicine, which shall be of immense value for our audiences. And yet, once again, we are here with all of you for one such scientific meeting with an aim to educate the importance of smoking cessation and nicotine replacement therapy. And to tell you more about it, we have with us one very eminent and an internationally renowned doctor, Dr. Pawan Gupta, who would be taking us through a very, very interesting topic on from smoke to science. What are the modern tools which are available for making tobacco-free future? Welcome, sir. Thank you so much for accepting our invitation and coming over to this virtual scientific platform. I think it's an absolute pleasure to share this virtual platform with Dr. Pawan Gupta, sir. And it's my honor and pleasure to introduce Dr. Pawan, sir, briefly. So can we have his short CV, please? Thank you so much. Dr. Pawan Gupta, sir, is a senior director and a surgical oncologist associated with Max Hospital in Delhi, in India. He brings in a very rich experience of more than 3 decades, and he's got an experience of performing more than 11,000 surgeries. He's a champion of non-invasive photonomics technologies for detection and treatment of cancer. He is an inventor, educator, influencer, and also an entrepreneur. He created mass awareness and developed most effective tobacco cessation protocol. C20 Integrated Health, he is the member of a core committee. Ministry of Health and Family Welfare in India is also the member of the advisory committee for tobacco cessation. For the NAMS Task Force for Tobacco Control, he is a member of Tobacco Cessation Subcommittee. Ministry of Social Justice and Empowerment, he's also been the member of the Consultative Committee. Telemedicine Society of India is the executive member. International Photodynamic Association is the ambassador for India. And he's also been part of multiple such committees, and he's got several awards and accolades in his name. He's got also patents. He's got numerous publications in his name. He's got multiple book chapters authored in his name. And he's also started several very innovative campaigns like Save the Youth, Catch Them Early, Tobacco Marshal, Win Over Cancer, and many more. I think it's a pleasure to have you with us, sir. And now, without much wasting time, I would like to hand over this virtual platform to Dr. Pawan Gupta, sir. And with this, I also request all the viewers who are watching us live from different parts of the country, both in India and international, to please post your questions in the chat box, which is right there in front of the screen, so that we can have a very fruitful discussion at the end with Dr. Pawan Gupta, sir. Thank you so much. Over to you, sir. Thank you so much.
Thank you so much for this wonderful opportunity that you have given me to interact with international doctors, international people, and that too on a very important topic. The topic is basically very much dear to me, although I am a surgeon, and this topic basically is something which is important for all the healthcare workers, whatever the specialty, whether they are surgeons, whether they are physicians, whether they are practicing a rural area, whether they are practicing in the urban area. It is an important topic, And selecting this topic, I really congratulate you, Jay, for putting this topic in front, and it's helping so many people across the world to understand and to implement this in their practice. So today we will be focusing on one particular agent that is helpful for helping people to quit tobacco, and that is the nicotine lozenges, which is quite new in the market, and which has shown to have very good effect in the entire system, or in the journey of a patient who wants to quit tobacco. And it's a very, very important armamentarium for all of us doctors who can actually give this to our patients, and it is easy to accept it. So just a few slides which is showing, I think this is almost every one of us know about it, that tobacco is the biggest killer, and it is killing more than 8 million people across the world, right? So, and I always say there are only two types of people in this world: one who take tobacco, the other who don't take tobacco. And this is how the world is actually divided. But important is that both the groups are as much affected by this tobacco, either because of direct smoking or because of the indirect smoking, right? So this is just a small data. I don't think I need to get into too much into it, but world over, if you look at the cancer scenario the world over, lung cancer is the highest in the world, and the cause of this is smoking. This is very important. And the most important thing that we also will like to understand, that lung cancer, the smoking, which is the commonest cause, so this is a preventable cause. If we can prevent it right at the beginning, if we can help a person to quit, I think we will be able to prevent lung cancer. Just today in my OPD, I got a just a youngster who is just 34-year-old, and he has been taking tobacco for the almost like 16 years, right? So he started when he was just, I think he was in just school when he had started, and without, he had come with his father for some other reason. But when I saw his oral cavity, I already could find some lesions in the oral cavity, and he has been taking chewing tobacco. And so I immediately asked him to quit, and he agreed that he would be ready to quit, right? So this is actually something that we can easily tell to our patients. We can motivate our patients by the right way, and it can be very helpful for them, right? At least we will be able to help these people not to die a pitiable death or a painful death in the future. So these are some common diseases. If you look at this, the cerebrovascular disease, the heart disease, the pulmonary disease, the cancer, these are the 4 major diseases caused by tobacco. And let me put it, the heart is the commonest cause of death because of smoking, right? So these are some of the very important aspects. But the most painful death, the sudden death, is by heart disease or the cerebrovascular disease, but the most painful death is because of cancer, right? And cancer is not the commonest because of tobacco, but cancer is the commonest cause, or the most preventable cause, because of the most preventable cause of cancer in oral cavity or cancer is tobacco. So these are another very important thing that I want to really highlight here. You would see most of these patients who are taking tobacco, they are aware that they won't have to quit tobacco. They should quit tobacco, or the tobacco is going to kill them if they don't quit tobacco. But however, they are not able to quit. Why they are not able to quit? And that's the one very major cause. You know, tobacco has got the highest addictive factor, and it regenerates, or it changes the whole brain system, by which the person has to, if he doesn't take tobacco, he gets a lot of withdrawal symptoms, the cravings, and so many other things, by which he's forced to take tobacco again and again, right? So this is the highest addictive. In the next slide, I will show how addictive it is as compared to other things. So this is again just something which you will see the heart disease, which causes so many things. It can cause blockade, the heart attacks, the aneurysms, the peripheral heart disease, by which the even we have seen I had to do a lot of amputation in some of my patients because they were not getting right blood supply to them because of the peripheral disease because of smoking. And there is a very high risk of brain getting affected, and that is because stroke is very common in these patients, right? And that is again of course the lung is the most affected, and that is where we are looking at how we can detect the damages early, and we can guide these patients to quit early. 70% of the patients who are taking tobacco, it has been found, this is a WHO report, 70% who want to quit tobacco, they intend to quit tobacco, they want tobacco. However, because they do not get the right people they can talk to, who can guide them, they are not able to quit tobacco. Self-quitting is only 4%, but if they get the right counseling, right doctor who can help them to quit tobacco, the quitting rate increases to almost like 30%. At my place, where I have been and I have been practicing regularly for the almost like last 8 years, 8 to 10 years, my quit rate is almost going up to almost 70%. So this is one slide which is showing, if you look at all the other drugs, like including cannabis, cocaine, so many alcohol and others, you will see the most addictive factor is tobacco. Just look at the other things, the other psychotic drugs and all these things, the addictive factor is low. It is possible to quit. What it implies, it is possible to quit other drugs, other narcotics and other things. But however, if it is very difficult to quit tobacco. If a person is addicted to tobacco, it becomes more and more difficult because of the addictive factor which is there. So, friends, I have a simple question for all of you. Like all of you are practicing doctors and you are engaging with a lot of your patients. So, what is the importance of tobacco in your practice, or tobacco cessation in your practice? So, this is a small question. You can take the QR code, and Trusha or Bhakti, you can share the share the link in the chat box so that they can just go through it, and we can discuss it and how important. There are only 2 questions. It will just take 10 seconds for you to answer. Over to you. I'll just wait for 10 seconds. Either you can just pick up your mobile phone, pick up the QR code, and you can answer, or you can just click on the link which is shared in your chat box, and you can easily. Are you able to do it?
Yes, sir.
Yeah. Okay. Is it done? So can I go ahead?
Yes.
Okay, thank you. So just looking at some of the results which we have done earlier, and you will see how important is tobacco cessation in your practice. This was a question that has been put to you, and you will see almost more than 95% of the people believe, or the practitioners, the clinicians know or understand that a tobacco cessation, if you get a patient who is taking tobacco of any form, whether it is smoking or chewing, they need to ask the patient to quit. And that is one very important. Yes, it is important in the practice. The second question was even more important. Will ensuring tobacco cessation in your patient improve treatment? If a patient is taking tobacco and he has come with some disease to you, would you like to ask them to quit tobacco? If so, will it improve the treatment? And almost like almost, I would put it like almost 100% of the doctors, almost 100% of the clinicians understand and believe that yes, it would, and they would like to help the patient to quit tobacco. And of course, this is the most important, and this is just a one picture which is showing how quitting tobacco actually changes the entire scenario for your patients. Even within, from the very beginning, even if 20 minutes from the time he has a craving, and if he doesn't quit tobacco, the pulse rate starts coming back to normal. Within 48 hours of quitting tobacco, the carbon monoxide, the carbon monoxide is one of the means something that we always check for our patients when we want to quit tobacco. The amount of carbon monoxide in the blood will give the severity of tobacco or the severity of chewing tobacco or smoking tobacco, right? So this is very important. The carbon monoxide returns to normal, it starts eliminated, and then the taste and smell also starts improving. Within 3 to 9 months of quitting, the lung functions improves, the cough, wheezing or breathing problem starts decreasing, right? And similarly, if you look at the other aspects, the breathing aspects, the heart attack aspects, the other things, they all over a period of 10 to 15 years, they start improving. So it is important that people who are taking tobacco over a period of time, they have to start. The moment they quit tobacco, there'll be improvement. But what are the challenges? So this is a cycle of change. One very important is how we see a patient who comes to you, at what stage of this cycle this patient is, right? So if you look at the first stage, that is the pre-contemplation stage. Pre-contemplation stage is the stage when the patient is not prepared to quit tobacco, right? And this is the commonest stage when the patient comes to you, right? The second stage is the contemplation stage. That means now he is prepared and he wants to quit tobacco. The third is the preparation stage. That is where we help these patients that how he can quit tobacco, and we help them, we guide them how to quit tobacco. And then that's the action stage. And in between the preparation and the action stage is the planning phase, the planning phase, where the patient is planning whether he will go at one go, he will go completely, he will stop, or he will go for a gradual withdrawal, right? So these are the various types of preparation or planning. And then comes the maintenance phase, which is from 3 months to the next 2 years. It is the maintenance phase. And then this relapse can occur anytime. If the patient is not careful, he can relapse at any point of time. So these are the phase. And we longest phase and which is most important phase. Most important phase is the change between pre-contemplation to contemplation, and that's the longest phase because it takes a lot of energy and how can help patients. That is the most important, and that is why most of us need to understand. And this is where what we call it as A, B, C, D of tobacco cessation. And that's what A is for active motivation, B is for behavioral changes, C is for comorbid management, and D is for drugs and medications. All these things as A, B, C, D, that proper system that we involve, this actually help the patients go through the journey easily, right? You will see the D is the drugs and medication, which I'm going to talk about particular medication, that is the nicotine lozenges today. But if you look at the other things, the active motivation, behavioral changes, these are the very important, the way we counsel these patients. Either we do it ourselves as the doctor, or we can have the patient or the assistants, who can guide or who can be with the patients to help them and guide them for quitting tobacco, right? So this is how we actually take it further. Here I'm just going to show you one patient of my cases which I treated, and he was taking almost 40 to 50 cigarettes per day.